I want to talk about two of my favorite bones in the foot, which are the sesamoids. So a lot of people don't know about these two bones, and they commonly are forgotten in the foot. However, they're two pea-shaped bones on the bottom of your big toe joint. So you can see it better on the inside, but they sit right underneath that big toe joint. What those two bones do is they help with a pulley system for your big toe. So there's a tendon that splits into two. It actually has two heads that goes on the bottom of your big toe joint, and it runs over both of those bones. So these are actually very important bones, and they can become inflamed. We can break these. They can also become arthritic because there's a small joint between these bones and your first metatarsal. And sometimes we can actually be born with what we call a bipartite sesamoid, which means this bone or this bone actually has more than one piece. Bipartite meaning two pieces. So you have your fibular sesamoid, which is the one closest to your second toe, and you have your tibial sesamoid, which is the one closest to the inside of your foot. Now, tibial, this is your tibia on the inside of your leg. Fibular, this is your fibula on the outside of your leg and ankle. So they correspond to the medial or inside of the foot and the lateral or outside of the foot. But you have two of them. They are my favorite, and they are also kind of hard to treat depending on what happens to them.